Benedicite. I am Mary Therese Pagay from BSN 2A, and today I'm going to demonstrate the bag technique. But first, what is bag technique? So the bag technique is a tool by which the nurse, during her visit, will enable her to perform a nursing procedure with ease and deftness, and to save time and effort with the end view of rendering effective nursing care to clients. The public health bag is an essential and indispensable equipment of a public health nurse, in which she uses to carry along during her home visit. It contains a basic medication and articles which are necessary for giving care. So here are the contents of the PHN bag. First, in the pocket of the bag, we have our surgical gloves. We also have our waste paper receptacle or cornucopia. And we also have a brown paper bag. Now on the top pile, center of the bag, we have our apron. We also have our soap in a soap dish. And we also have our hand towel in a plastic bag. This is used later for hand washing. Also, in the center of the bag, we have our kidney basin. We also have our sterile cord clamps. We also have our hypodermic needles, gauge 19, 22, 23, and 25, but I only have the 22 and the 25. We also have our syringes. This is 1 cc, 3 cc, and the 5 cc syringe. And we also have the roller bandage, sterile dressing, and the cotton balls. Also, we have our forceps, one straight and one curved, and the surgical scissors. For the back of the bag, from left to right, we have our alcohol, which is 70%. We also have our Theromycin ointment, the hydrogen peroxide, the betadine solution, our spirit of ammonia. This is used to prevent or treat fainting, the acetic acid, and the Benedict's solution. On the left rear of the bag, we have our baby scale, bandage scissors, and the rubber suction. On the right rear of the bag, we have our alcohol lamp, our test tube and test tube holder, and also the medicine dropper. On the front of the bag, from left to right, we have our adhesive plaster, our thermometer in case, we also have the tape measure, and our tongue depressors and cotton applicators. More importantly, we must have our black umbrella. This is used when roaming around the community. And also note that the blood pressure apparatus and the stethoscope are carried separately and is not in the bag, and that the folded paper lining is inserted between the flaps and the cover of the bag And we must also remember that we have to make a waste paper receptacle or a cornucopia before doing the actual procedure. Here are the principles of the bag technique. First is that performing the bag technique will minimize, if not prevent, the spread of any infection. Second, it saves time and effort in the performance of nursing procedures. And third, the bag technique can be performed in a variety of ways depending on the agency policy, the home situation, or as long as the principles of avoiding transfer of infection is always observed. And now, here are the principles to consider in the use of the PHN bag. First is that the bag should contain all necessary articles, supplies, and equipment which may be used to answer emergency needs. Second, the bag and its contents should be cleaned as often as possible, supplies replaced and ready for use at any time. Third, the bag and its contents should be well protected from contact with any article in the home of the patients. We must consider the bag and its contents clean and or sterile, and any article or equipments belonging to the patient as dirty and contaminated. Also, the arrangement of the contents of the bag should be the most convenient to the user to facilitate the efficiency and avoid confusion. Of course, hand washing is done as frequently as the situation calls for. It helps in minimizing or avoiding contamination of the bag and its contents. And the bag, when used for a communicable case, should be thoroughly cleaned and disinfected before keeping and reusing. Greet the client, introduce yourself, and state the purpose of the visit. This will form the basis of the patient-provider relationship. Upon arriving at the client's home, place the bag on the table or any flat surface lined with paper lining and plastic lining with the clean side out or folded part touching the table. This is to protect the bag from contamination and facilitates the creation of a non-contaminated field. The plastic and paper lining protect the bag and its contents from contamination. Put the bag's handle beneath the bag to work with ease and convenience and to protect the bag from contamination. After placing the bag on the table with the paper lining and the plastic lining, we're going to ask for a basin with water or a glass with clean drinking water in order to do hand washing if no faucet is available in the community. And remember, we must put that away from the working area to avoid getting the working area from being wet. Take out the towel, soap dish, and apron and place them at one corner of the work area. It must be within the confines of the lining or plastic lining. This is to prepare for hand washing. Perform hand washing. Hand washing prevents possible infection from one care provider to the client. Pat dry with towel. Put on the apron right side out and the wrong side with the crease touching the body, sliding the head onto the neck strap and neatly tying the straps at the back. The apron is used to protect the nurse's uniform, and keeping the crease creates an aesthetic appearance. After putting on the apron, now we're going to put out the things or the articles needed for the specific case. For example, if I'm going to do perineal care, then I'm going to only put out the things or articles needed for perineal care. If I'm going to demonstrate or perform the Benedict's test, then I'm going to take out 3 things or the articles needed for performing the Benedict's test. In that case, I'm going to need the alcohol lamp, test tube, the test tube holder, and the Benedict's solution. place the waste paper bag outside of the work area. After that, we're going to proceed with the specific nursing care or treatment. After giving the specific treatment or the specific procedure, now we're going to clean all the equipments that were used and we're going to perform hand washing. Also, the cornucopia or the waste paper bag must be discarded to its proper place. Remove the apron folding away from the body, with the soiled side folded inwards and the clean side out. Afterwards, we're going to place it in the bag. Fold the lining and place it inside the bag and then close the bag. After that is we're going to make post-visit conference on matters relevant to healthcare, taking analytical notes preparatory to final reporting. Also, we must make an appointment for the next visit either at home or at the clinic. Also taking note of the date, the time, and the purpose. That will be all for the bag technique. I am Therese Pagay from BSN 2A and thank you for watching.